And welcome back to Inclusion Revolution here on Eastlink Television. And when we broke away, Dr. Jason Fox was just about to tell us how we can create a revolution in terms of our own personal healthcare choices and being more inclusive of all the options that are out there. So Jason, just to pick up where we left off a little bit, we were talking about the revolution and how we believe everybody has to start with education. Right. And that's certainly something that I also believe. So first step is not just educating of doctors, although I'm really thrilled to hear you say that, and I'm not sure how we as a community are going to do that other than, as you said, go to your MPs, go to your community leaders, encourage that kind of dialogue to be opened up. But tell me, for that individual who's listening to us today, who perhaps lives with chronic pain, which is very common, and let's say where your specialty back or migraines, because I know a lot of people don't understand how helpful, for instance, chiropractic and acupuncture can be. So let's talk about a person who's suffering from migraines, has gone to their GP, and has been given whatever medications, and we know around migraines there's a lot of imperfect medication. That said, I realize people don't come with instructions. Every patient has to be treated uniquely and differently, but just for the purpose of our listeners to get a few steps on how to create that revolution for themselves.
Well, we're very fortunate in Halifax that there is many different types of practitioners here that offer different types of complementary and alternative health care. And, you know, going to a friend, there's lots of people using these types of services. First of all, if you are experiencing this sort of stuff and you're part of a group, you know, support group, talk to people in those groups. I mean, a lot of people, nurses that are very well educated, they're trained holistically by nature. They have a lot of really good ideas, and usually they're in touch with, you know, various practitioners that, you know, do different types of care for their ailments and offer alternatives, you know, to the medication that may not be working or is very costly.
So that individual's coming to their doctor, as we all do when we have a medical situation. First, we start at our doctor, or our GP, as we like to call them. And our GP says, you know, the traditional approach to this migraine is to give you these certain medications. I know I have a number of friends with severe migraines who are on and off different medications, always trying to find that balance, especially around cluster migraines. For those of you who don't know, that is the worst. But, you know, so that person goes to the GP gives them the med. It's working kind of, but what else can they be doing at that moment?
Well, I mean, like I say, if you know somebody that has a similar problem and they have an acupuncturist, or they have a nutritionist, or they have a chiropractor that can help.
Can they help? I mean,
absolutely.
Can those types of medicine approaches actually help with migraines?
Well, I mean, there's various types of acupuncture has been effective in relieving many sorts of pain syndromes. I don't do it myself. I know lots of people that do. Chiropractic, I mean, cervicogenic or tension type headache is the #1 type of headache that is dramatically improved with chiropractic, migraine being the second most, and for the most of other types of headaches, you know, chiropractic is not that effective. It's been shown in the research. So migraine definitely comes into that. And I mean, but there's also massage therapy, okay? You know, a lot of people that have headaches, a lot of times it's because they're not eating properly. A nutritionist or a naturopath.
Not the things we automatically think of when we connect with I've got a bad headache.
Well, you are what you eat. Okay, and we know that caffeine does a great job in a lot of medicines.
Jason, I'm in trouble.
Yeah, I know. Well, you know, we know it affects the sympathetic nervous system, which has been shown to cause, you know, spasm of the arteries in the back of the neck, which do, you know, cause this unilateral throbbing type of headache, which is very disability.
I thought it was my husband.
Yes, well,
but you're telling me it's my diet, so he'll be very happy to hear that. So, Jason, what I'm hearing is the step. Okay, we've educated ourselves. We first find out who do we know that's dealing with those issues, and going beyond the traditional GP.
That's right.
What about talking to our GP about it? Are we going to expect, because people are really, I find, very afraid to ask their GP to look at alternatives to other than to what they're offering us, if that makes sense?
Well, this is what I say to people, because all of my patients that I've helped, okay, you know, have a GP.
Right.
Okay. So I ask them to go back and say, look, you know, tell them about your results, good or bad. Tell them about your experience so that you can educate them, right?
And that's a form of educating your doctor.
Sure. I send a card with a lot of patients. I'm starting to write letters now to the general practitioners and giving, just to kind of open up lines of communication, to let them know what I'm doing, what forms of therapy that are beneficial in the scientific literature.
So you're actually reaching out presently, which is, by the way, a very neat thing you're doing, and something that's a little different, is you're actually reaching out to the traditional medical doctors and giving them information on the kinds of things you're doing successfully, and that in a way is your way of educating the medical field.
Tova, we just talked about this at the first thing, right? Education. So I know that if I'm not educating my patients, okay, and I'm not educating, you know, the policymakers in healthcare, if I'm not educating the medical practitioners that are all around me in my area, okay, of the benefits of what I can do to offer their patients, and what other alternative therapies can do if I cannot do it. We're all stops along the river, right?
Right.
We may not be the only thing, and I think that medicine has a very, in North America, we talked about this earlier, right?
Yes.
We are 6% of the population.
Right.
In North America, the world's population, yet we consume 66% of the pharmaceuticals.
Is that because we've got the money?
That's exactly why.
It's a money
it really
thing.
Is.
Let's call it.
We really do. I mean, we have people that are dying of other sorts of bacterial infections, that are so easily treated with antibiotics, and they cost pennies a day, and yet we take that for granted. I mean, we get up to 22 vaccines, in the first 20 years of our life here. I mean, that is amazing. But that is our only preventative thing. We are very good at trying to prevent other sorts of viral or bacterial infections, but our lifestyle things, the things that are really killing Canadians, okay, which is heart disease and cancer and respiratory illness, are all preventable disabilities.
Okay,
right?
you brought something very important up, the word preventative.
I love
it is
preventative.
not a word that is used a lot in our medical community here in Nova Scotia, at least not that I've heard.
I think we've talked about this again. There is I looked at the current statistics on what we spend in Nova Scotia on preventative measures. Okay?
Correct.
There was nothing there.
You mean zero?
Zero. I mean, there was.
Do you
dashes.
have other provinces that have other amounts that they're spending?
I think there was only, I believe, there was only 2 provinces that really didn't spend anything on, or didn't document.
We were one of 2 provinces that has not documented any money that's being spent on preventative. And if you want to talk about a revolution.
Wow.
In medicine, the revolution is to start looking at preventative approaches.
Sure.
And I really hear that from you. Jason, I had a couple of questions come in from persons with disabilities through our email, and I just wanted to, as we wrap up, ask you a couple of things. One of them asked me about the use of the we.
The we.
Because I know it's hip,
yes.
but is it also, again, a totally outside the box approach to healthy living?
I love it.
You love it.
I love it. And this
it's
is
okay?
Why. Yes, I love it.
Oh, good. Because I like the tennis.
Yes.
Okay.
Well, okay. Well, and that's good. And that's
but the yoga I know is really great.
Yeah, it's the We Fit. It's really the We Fit. I think it'll revolutionize people who, it's hard to follow, Jane Fonda on a workout tape, right?
Boy, are you dating yourself.
Right, of course. We talk. Okay, but I think it's important that, if we can use technology to get people active, and the yoga that's on there and the type of things are the same stretches I give to my patients. So if they go home and they say, I don't need that, I have it on my Wii, and they do it, and they're doing it 2 or 3 times a day, they're really trying to better themselves, trying to get their fitness level up, trying to help improve their quality of life, then that's fantastic.
So in other words, they're educating themselves and they're taking non-traditional steps to approaching a traditional thing, which is health.
Yes.
But we've been approaching it without the preventative piece, which I think if we're going to say any revolution needs to start in this province, it's the approach to preventative medicine.
Absolutely.
So Jason, I want to wrap up this segment and thank you so much for the opportunity to talk to you. I know we're going to have a lot of questions for you. Maybe we can have you back and talk some more.
I would love to.
We'd love
Thank
that.
you so much.
We'll be right back after this break with Inclusion Revolution.